Strep is a complex and often misunderstood bacteria that reaches far beyond strep throat, with complex impacts on our health and even deeper connections to conditions like PANS, PANDAS, and Group B strep in pregnancy. Today, we're diving deep into everything from understanding the bacteria itself, exploring why traditional treatments like antibiotics often fall short. You'll learn actionable steps for healing strep related conditions, and we'll go deeply into what these conditions are, how they develop, and symptoms to be aware of. By the end of the episode, you will feel empowered with the knowledge to take charge of your family's health and make choices that align with your body's natural healing potential. Welcome to Follow Your Gut. I'm your host, Juniper. If you found yourself here, it means you're ready to unlock the happiest and healthiest version of yourself and step into your role as the most confident leader of your family's wellness. Together, we'll navigate the path to optimal health and vitality. Let's dive in and transform your life. First, let's start with what strep actually is. Strep, or streptococcus, is a type of bacteria. And while most people are familiar with strep throat, it's actually just one of many strains. In fact, there are over 100 known strains of strep, most of which are categorized into two main groups, Group A and Group B. Group A streptococcus, or GAS, is responsible for infections like strep throat, scarlet fever, and more severe illnesses such as rheumatic fever. This is the strain most people think of when they hear about strep because it causes the classic sore, red throat, and fever symptoms. Group B streptococcus, or GBS, includes the well-known strain that commonly lives in our gastrointestinal and urinary tracts. It's typically harmless for healthy adults, but it can cause really serious infections in newborns and is why pregnant women are tested and given antibiotics during pregnancy if they test positive for GBS. Other strains can lead to pneumonia, ear infection, and even dental issues like tooth decay. While each strain really varies in how it interacts with our body, the disruption that strep causes to your gut microbiome and your immune system is why understanding these strains is so important. When it comes to treating strep, antibiotics are the go-to solution. And they work. They work by quickly killing the strep bacteria, but they don't differentiate between harmful bacteria and the beneficial bacteria that your body needs. This causes a disruption in your gut microbiome, which is your body's own vital ecosystem of bacteria. When this balance is disrupted, it creates an environment where harmful bacteria are more likely to thrive and our immune systems become greatly compromised. The microbiome plays a crucial role in training our immune systems to recognize and respond to pathogens. But when we take antibiotics and we wipe these good bacteria out, our bodies lose this essential layer of protection, which makes it easier for strep or other harmful bacteria to move back in and cause a reinfection. This is why after you treat strep throat, you see lingering symptoms. Maybe you develop a little rash. Maybe you have fatigue for a long period of time. Maybe you develop constipation or diarrhea. You stop sleeping. Maybe you experience a heightened of depression or anxiety. This is from the treatment of your strep throat. This is because the foundation of your body was disturbed not only by the strep itself, but then also it was compiled by the antibiotics. This weakened microbiome also leads to increased inflammation, which puts further strain on your immune system. Antibiotic use can create a really hard cycle. The immune system becomes less able to resist infections, while the gut struggles to restore its beneficial bacteria. In fact, studies show it can take up to 2 years for the gut to restore itself after just one round of antibiotics. And remember, when you started those antibiotics, your gut was already compromised. It's going to take 2 years to get back to that pre-compromised state. This makes it not only easier for strep to return, but for other health issues like mental health, digestive, and skin issues to develop. We have all been conditioned to believe that antibiotics are the only option for fighting infections like strep, right? Your child gets strep throat. You test positive for group B strep during pregnancy. Whatever strep you are experiencing, you are told you have to take antibiotics. That's the only thing that's going to kill the strep bacteria. This creates a serious dilemma, leaving so many of us feeling torn because, on one hand, there's an urgency to kill the bacteria, of course, but on the other, there's significant risks that come with disrupting our delicate microbiome, especially in young children whose microbiome and immune systems are still developing. And for pregnant women, where supporting a balanced microbiome is not only crucial for her pregnancy, birth, and postpartum period, but also for baby. So, what's the alternative? Rebalancing. Rebalancing works by targeting and eliminating harmful bacteria like strep while allowing beneficial bacteria in the microbiome to flourish. This restores harmony within your body, which strengthens your immune system and empowers your body to handle infections naturally, all while creating an environment where beneficial bacteria can thrive, which leaves little room for harmful bacteria to exist. In a little bit, I'm going to share with you exactly what I would personally do if my child got strep throat or if I tested positive for group B strep during pregnancy. But first, I want to talk about a lesser known condition that affects so many children. PANS stands for Pediatric Onset Neuropsychiatric Syndrome, and PANDAS is a subtype. It stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. These conditions occur when a strep infection triggers an immune response that affects the brain, leading to the sudden onset of neuropsychiatric symptoms. Children with PANS or PANDAS may experience severe symptoms almost overnight. Parents might notice things like obsessive compulsive behaviors, extreme anxiety, tics, mood swings, and even rage episodes. In these cases, the immune system is essentially overreacting to the strep infection, attacking not only the bacteria, but also parts of the brain. This autoimmune response can be heartbreaking for families because, again, it most often disrupts the child's behavior, learning, and overall quality of life overnight. Parents of children who have experienced PANS or PANDAS, they say it's like they literally feel like they lost their child overnight. One night they went to bed themselves, the next day they are experiencing extreme OCD type behaviors or explosive outbursts, mood swings, tics. It's really, really scary to experience PANS or PANDAS, especially because these are conditions that are unfortunately not always recognized in mainstream medicine. These parents are taking their children to the doctor, and these Western doctors who are unfamiliar with the immune response connection often misdiagnose these children with psychiatric or behavioral disorders and prescribe medications to manage the symptoms without addressing the root cause. This means that many of these children are put on strong psychiatric drugs when the underlying issue is actually an autoimmune response triggered by strep. One of the most challenging aspects is that many children with PANS or PANDAS never show classic symptoms of strep, like a sore throat. Often, strep bacteria can be present in the body without causing any sign of infection, which means parents and doctors may have no idea that strep is even a factor. Neurological conditions don't typically appear overnight. You have to know this because having this awareness is incredibly powerful. If you ever see a sudden onset of behavioral or neurological changes in your child, especially symptoms like obsessive compulsive behavior, mood swings, or motor tics. Explore the possibility of PANS or PANDAS. The earlier you heal their body, the better it is, but it's never too late. And healing is absolutely possible. Typical treatment for PANS and PANDAS, again, is antibiotics. But considering how antibiotics impact the gut brain connection, this can lead to increased anxiety, ADHD symptoms, and behavioral issues. This approach is not ideal because remember, their immune system is already attacking the strep, but it's going further and it's attacking their brain. We do not want to further compromise this gut brain connection. Just like with strep throat or GBS, rebalancing is a beautiful alternative. It not only kills the strep, but it helps create an environment that allows the body to heal. It helps clear the inflammation. It clears the miscommunication between the gut and the brain. I want to pause here for just a moment, though, to acknowledge that sometimes antibiotics are necessary. And there are cases when going that route will intuitively feel right to you, and that's okay. Antibiotics can play a really crucial role in certain situations. And if you feel it's necessary, you trust you over anybody else. But if you do choose this path, remember how important it is to intentionally restore the gut afterward. Rebalancing will help rebuild the microbiome, strengthen the immune system, and protect the vital gut brain connection so healing can continue in a way that promotes long-term health. Now I'm going to share with you exactly what I would personally do if my child had strep throat or if I tested positive for group B strep during pregnancy. For strep throat, I would follow the full gut rebalance protocol with one additional step. Gargle with cleanse before swallowing. The longer you gargle, the more effective it is, and it allows cleanse to target the bacteria directly in your throat. This goes for you, this goes for your child. I know some small children, it can be hard. Just try to teach them. They think that gargling is really funny. So make it a game, do it with them. For PANS or PANDAS, I would follow the rebalance protocol, but instead of tapering off the initial larger dosage of cleanse after 4 days, I would continue this higher dosage and add a third dose midday. This provides consistent support to the immune system and the microbiome while targeting the strep bacteria. This is going to be really, really powerful for helping heal that gut-brain connection. For group B strep during pregnancy, I would begin rebalancing as soon as I found out I was pregnant. If I didn't, or if I did and I still tested positive for group B strep, I would start rebalancing in my third trimester, ideally around 35 weeks. So the protocol overlaps with birth and postpartum. If I did test positive, in addition to following the full rebalance protocol, whenever I showered, I would wash with the wash bar soap. And I would apply Relieve to my vaginal area morning and night to support the vaginal microbiome and ensure that strep doesn't persist in that area. Thank you for joining me in this deep dive into strep and the power of rebalancing. Whether it's strep throat or understanding more complex conditions like PANS and PANDAS, I hope you feel empowered to explore this healing approach that nurtures your body from the inside out. Remember, true healing begins in your gut, and by supporting our microbiome, we give our immune system the best chance to thrive. At the end of the day, always listen to yourself. You know best for your family and yourself. Every episode on this podcast is intended to empower and educate you to make your most informed and aligned decisions. I'll catch you next week. Thank you for joining me in today's episode of Follow Your Gut. If we don't know each other, I'm Juniper Bennett. I'm a homeschooling mama to my 4 children, a dedicated microbiome specialist, certified family health coach, author of the Microbiome Cookbook, and the founder of Only Organics. a supplement and education brand focused on women and children's gut health. Make sure to subscribe to the Nourished newsletter so you never miss an episode. Along with everything else mentioned in today's episode, there is a link for you to subscribe right below in the show notes. Lastly, it's important for you to know that the information shared on this podcast is based on my personal experiences and research. Please always trust your own inner voice of wisdom and your healthcare professional. Until next time.